We are going to discuss a little bit complicated optics because the method of adapting telescope for near use, and another point is how telescope going to correct refractive error of the patient. So both of this topic needs a little bit brush up of the optics and a little bit more concepts you have to put, and you have to think a slight different way. So let me first introduce how to think. Okay, so let's take an example. If I draw this picture of lens, and if I tell you this is the focal point, which is primary focal point. So if I put object here, then what happens? It is track the lens and then it goes parallel, isn't it? Isn't it? Yes. Okay, then again same object, and if I put this is the focal point, what happens if I put object here? Isn't it that's what we have already discussed in case of convex lens imaging? If in between f and lens, then light hits and it do not converge, it do not go parallel, it goes again divergence. Okay, that's why it creates what it creates, virtual object, isn't it? So it's a very 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 simple thing. So uh, I think you know this thing. Okay, wait, uh, let's go there, baby. Okay, fine. So it's a very simple thing. So, and what happened if lens is there and it is focal point and on object is here? Then definitely this creates what? Convergence, isn't it? After light hitting the point. So it is very simple thing. We know it. This is the basics, isn't it? This is very basics. Now, can we think like this? Wait, I want to tell you a little bit more and correlating things. So this is our ocular lens, and this is our eyepiece. Let's take an example of capillary lens. So light comes from infinity, definitely, isn't it? For the distance object, it's going to focus here, okay? And its secondary focal point of objective lens, which is f dash for this lens, f1 f dash, and f2 primary focal point of eyepiece, primary focal point of eyepiece. So for two lens, and this is one lens secondary focal point and two lens primary focal points, because I haven't give their dash. Is secondary focal point somewhere here, f2 dash, yes, f1 primary focal point. If they match, then don't you think its primary focal point here is the object? From object vergence, light come as a diverge. If object is f, then light goes parallel, isn't it? That's what the concept of telescope. So the image made by first lens f1 is become object for second lens. And now I want to tell you one more important thing. It depends upon the object. It depends upon the object of the second lens, that where this lies, light goes parallel or light goes convergent or light goes divergent. Let's take an example. If image made by first lens fall here and primary focal point of second lens is here, this is primary focal length and this is the focal point from first, then don't you think light goes divergent when it exits the system? It's simple thing, isn't it? If primary focal point second system is here and light fall here, for example object fall here, for example this light converges here, then don't you think it's simply exiting light would be converging, isn't it? This is the simple thing, don't you think so? So let's take an example. I'll make one picture. See, this is the second line, second, and this is the focal point. If object, which is definitely virtual, a real image made by first lens, fall here, light becomes parallel and exiting parallel. When object fall here, light exiting converges. When object image fall here from the first line, light goes diverging, isn't it? That simple thing you have to understand first, then everything will be okay. So see in this picture, isn't it? Secondary focal point of this lens exactly coincide with the primary focal point of this lens, this eyepiece, and then light goes parallel. From parallel, it goes parallel, isn't it? This is the Keplerian lens, and this is exactly Galilean lens because secondary focal point of this lens. What is the secondary focal point? This, isn't it? So the secondary focal point of this lens matches with the, what is this? Primary focal point of this lens, because this is a negative lens. Negative lens has primary focal point in this area, isn't it? For minus lens, primary focal point is here, secondary focal point is here, isn't it? So for this lens, this is its primary focal point. So secondary focal point of this lens coincide with the primary focal point of this lens, and this parallel line goes parallel. Isn't Galilean telescope simple? Now whenever we try to change things, we have to play with these 3 points. Okay, so let's move. So methods to adapt telescope for near use. First method is increasing power of the objective lens or adding reading cap. This really is the most easy method and most using method in low vision case, because adding reading cap is very comfortable than doing all things. Okay, so adding reading cap means simple, it's not complicated. Let's first read. Diverging wave front striking the objective lens can be neutralized by adding reading cap to the front shelf. Working distance telescope is equal to the focus reading cap or additional power of add. The equivalent power we can calculate from this power of a reading cap into telescope magnification, which I really see. This is how it works. If it is telescope, is both system is telescope, then let's take an example. This is the lens. Okay, I'll make this lens is a reading cap add lens, and for example this add is plus 33, sorry, plus 3 diopter. So suppose if something lies on the 33 centimeter, light comes, then isn't it a focal length? Then light exit parallelly. Then telescope, as we know, it always does one work, that light comes parallelly, exit parallelly, and it do its magnification stuff. So normally you just have to understand the cap power. What its work is to send the light to the telescope in a parallel fashion. So as telescope work, usually the parallel light comes in the telescope and focuses somewhere and exiting somewhere, and parallel light exits, isn't it? So it will work with the parallel light, and the only work of the reading cap, add of the reading cap, is from the focal point, light sending towards the telescope is parallel. So it's very simple. Okay, this is how it works. And this thing we call telemicroscope, and just remember the working distance of telemicroscope is always inverse of reading cap. If reading cap power is 2 diopter, the working distance is 50 centimeter. Reading cap power is 3 diopter, working distance is 33 centimeter. It's always is focal length. And isn't it focal length means you Send light from focal length, you put object on the focal length, then light goes parallel, and that's parallel light used by telescope, because telescope always work in a parallel light, which is very helpful. So that's simple concept. So method adapted to the telescope for near use, and second method is to decreasing the power of ocular lens. Okay, so this is the significant amount of accommodation is required for the clear imaging by diverging ray image eyepiece and require see, I'll show you simple video. In case of uh, how much power is needed for accommodation, let me show you. See, there is simple formula, that is uh, image versions is equal to m square into object versions. M means, let's take example. I'll give you example. Okay, example, 6 times magnification is a telescope, and let's say the object is at 50 centimeter. 50 centimeter means 2 diopter. Simple. So object versions is 2 diopter. Magnification telescope magnification is 6 times. What will be the image versions? See, 6 square into 2, 36 into 2, 72 diopter of accommodation is needed. Is it possible? God knows. No, not at all. So it's quite difficult to do these things. So to force accommodation and to see the near object. So it's, you remember this formula and you'll see in the books too, but it's quite difficult to do. So this solution is not viable always. It's very difficult for clinically to apply this method. So let me just finish here. Okay, this is the question. It will always come, and it is easier to focus definitely with the Kepler telescope. Yes, definitely. For both Galilean and Kepler telescope can be made focal by increasing tube length or separation of the lens element. Okay, now I am going to draw again. Just focus here. Let's take an example. This is ocular piece and this is eyepiece. Okay, let's take example. Light comes here, so focus is here, and it goes, and again it goes parallel. This is how telescope work. Okay, so let me draw another picture. I'm making this telescope longer. Okay, so now separation is higher. So what happens here is, see, the first telescope has same focal length, isn't it? Okay, see, first have same focal length. Now, can you just imagine focal length is same for the first ocular piece, objective. Now, when the distance increases, the primary focal point of this eyepiece must be somewhere here, and object is here because image made by the objective lens is an object for ocular eyepiece. So this is the object and focal length is here. What is supposed to be happen when light is going out? Then light must be converging, isn't it? Isn't it? Yes. Now just think. If you have to push this point towards here, what is the option? You must send diverging light, isn't it? And diverging light, you have two options. Either you put minus lens or you focus on near object. That's why when you focus on the near object, this focal length shifts towards up to this, and here parallel light comes. And this parallel light, it focuses by our eyes. And this is the way, this is the same way. If final end product is converging light, it will correct hyperopia too, isn't it? It's a simple thing to understand. Okay, it's a very simple thing to understand that if object is nearer, then this primary focal point pushes towards this, secondary focal point pushes towards this, where eyepiece primary focal point located, and eyepiece primary focal point gives the parallel light, exiting parallel light with a magnification. That's why if you want to see the object at near, you have to lengthen the tube length. You have to increase the tube length, no matter what. It's no matter Galilean or no matter Capillary. Central concept to understand. This is the concept, okay? So these three ways how we convert the distance telescope for the near, it's finished. Now we are going to talk about compensating refractive error. Adding the refractive correction to the eyepiece and alternating encourage the patient to view through their gun. This is the best thing. See, patients should view with the correction by their glasses. This is simple. But if you want another option, then you can add eyepiece. You can add patient's refractive error correction in an eyepiece. Just add it. It's very simple. You don't have to understand many more things. Okay. So there will be calculations in this regards, but I am not going to talk about. I am going to talk. Let's see what happened. And this is the point, main point I am going to talk. So altering the telescope length, myopia can shorten the telescope, alternating the emerging light parallel to diverging, resulting in less enlargement in Galilean telescope and greater enlargement in the astronomical. See, less enlargement and greater enlargement, it's another point. I want to make sure that you understand optics. How, if you alter the telescope length, in case of myopia, telescope must be shortened. See, in this picture, I'll tell you. To correct the myopia, tube length must shorten and must shorten no matter what. Tube length must shorten. In case, as you have seen that in case of when we're trying to make telescope for near vision, then what we have done? We have done lengthening the telescope, isn't it? So I have told you in this case, lengthening the telescope always correct hyperopia, isn't it? Always correct here. But it's different in case of magnification. For magnification, if you shorten the magnification, Galilean telescope magnification decrease, Kepler telescope magnification increase. For hyperopia, if you lengthen the telescope, Galilean telescope magnification increase and Keplerian telescope magnification decrease. Sometimes it's very tricky if it comes in MCQs. So okay, it's egal, doesn't matter. Wait, let me tell you one simple thing and then you will understand. See, this is our eye, and if you are myopic and if you are putting this glass, okay, its secondary focal point is somewhere here. And what is the principle? Secondary focal point of this glass must coincide with far point of an eye, so that light comes from here infinity, it diverges, okay, it diverges, okay, it diverges, it diverges and it focused here, but divergence by secondary focal point of glasses, it falls here, isn't it? So main moral of the story is I needed exact amount of diverged light, isn't it? Isn't it? Let me tell you one thing. If I'm myopic, suppose example, what I need is diverged light, isn't it? Can't you think like this? If I'm hyperopic, no matter what, contact lens, telescope, spectacle, in product I want converging light, isn't it? So that my eyes get corrected. That's the simple thing. So at the final analysis, what you need is a diverging light to correct myopia. So let me tell you again. Let me draw again. This is the picture when light comes. It focuses here and it diverges. Primary focal point and it's here we go. But what happens if I shorten the length? Okay, if I shorten the lens, light came, it focuses same way, but now another point, this eyepiece come closer. So what happened here? Isn't it object is here and focal point of telescope is here. Now see, this is the focal point and of eyepiece, definitely. Then object is here. What happens? Isn't it diverging light comes from it? That's why we learn, isn't it? If light object fall in focal point, light exit parallel. Each object focus focal between the f and optical center. Light always come divergent, isn't it? So that's why light goes diverging, because this is the object, and when we shorten the telescope, this is the focal point of this eyepiece. That's why light diverges, and when divergent light comes, it will definitely correct myopia. Simple. So the same case happening there, isn't it? Because this is the focal point and this is the object, because image of first lens is object for second lens. And when object is very far from focal point, light converges. And what happens to converging light? It corrects hyperopia. That's why you must lengthen to correct hyperopia, you must shorten to correct myopia. And we will discuss why magnification decreases, because it's calculation. So I let it for now. I don't want to discuss this. I will discuss in my low vision series of videos. I think I'll make them in 3 months later, but for now this is it. So this is a good book to start for optics, and today I have taken a lot from here and here, and this is very good book, and this is my favorite book of all time, Professor Dr. George S. Melly. So this is it for today. Bye bye.